y'all, I'm Mary.
And I'm Carla.
And we're the Smiley twins. And we are going to do an episode today on Not Just Lip Service about kind of some recent things that have come out in the media. And just kind of see where that takes
happenings in the medical aesthetics world.
Right. See where that takes us. So there's been a few things, a couple clinical things, and then
it's been spicy.
And then something about, non-competes from the Federal Trade Commission, which, affects not just the medical industry, but everybody. But so which one should we do first?
Let's talk about
two clinical ones, and
let's talk about the botulism that some people from some Botox injections, which has triggered some stuff that we're even feeling. Like it's I think the cascade from this is going to be is going to start some regulations and put some gasoline on a fire that was like crackling, and now it's gonna
so we at least at Smiley Aesthetics, we welcome like all compliance things. In fact, we're like hoping for more compliance essentially.
Yes.
Like, I don't want anybody, I don't want to be like nervous all the time or anything about like things changing in a way that'll but I mean, I look forward to
compliance.
I look forward to showcasing our compliance, and then also what is in place and what rules are currently in place being audited and enforced and QC'd and stuff like that.
So, and also shown to also be not appropriate or antiquated based on medicine and things like that, and so to therefore be changed. The whole gamut.
So the CDC did launch a formal investigation, which is good. That's great. Into this whole thing where, I guess a recap for in case anyone doesn't know, but there were, it started in Tennessee, I think, but there were a lot of cases now in like 12 states or something. A lot of reported cases of botulism side effects, which can occur from Botox in either in very, very large doses, so non-cosmetic doses. So in the operating room, for example, a urologist they don't even use that big of doses, but they use 200 units in a bladder during bladder surgery. Or, for example, back surgeries, to calm down muscles can be in the hundreds to thousands of units. And sometimes that can cause side effects that, we are prepared for and aware of. The other time you can see side effects that mimic botulism are when you use counterfeit Botox. Fake Botox.
That is, in fact, probably has botulism.
So for people who don't know, it is a federal offense for Smiley Aesthetics, for example, to get our Botox from anyone other than Allergan, which of course we do not do. Reasons why providers or medical practices, medical spas might do this are because it's cheaper. So I could order it from Korea, get DM'd literally every single day about someone having Botox in Korea.
And filler products. All kinds of stuff.
And I mean, it costs us hundreds of dollars per bottle of Botox to buy. FYI, that's why it's so expensive. And we can get it for hundreds of dollars cheaper if we buy it from overseas, basically, or for counterfeit places. So same for any of our medical aesthetic products. It is a federal offense to import them, which is what you are doing when you buy them from an overseas company into the United States. And then also, FDA approved things are what's required in the medical space, and those products are not FDA approved. The FDA approved product is from Allergan, whose parent company is AbbVie. And that is where everyone should be getting their Botox from, and that is the only place that's allowed. So apparently these, I think 100% of the people involved in this case, the providers, I'll use that term loosely, were not medical. They were non-licensed medical providers, thus far from what I've seen in the ongoing investigation, meaning they were not nurses, they were not doctors, they were not nurse practitioners, they were not PAs. They did not have any type of medical license to be able to be injecting prescription medicine into the human body, which is why they were getting their stuff from somewhere other than I'm not talking that fast.
Yes, you are.
Okay, well, keep up. So getting their stuff from somewhere other than Allergan, because you have to be a medical provider in order to get your products from the proper place. So, so what they were getting was obviously not manufactured correctly, created correctly.
Well, you only have a medical provider director.
Sure, you have to have a medical director, which would then you would think be giving those products to the correct. But obviously these people don't have that, nor are they getting them from Allergan, and that seems to be in 100% of these cases, which is good news for any of our clients listening to us, because this has never happened with Smiley Aesthetics, has never happened that I'm aware of with Allergan products in the cosmetic space. It doesn't, because it's manufactured properly and the way it's supposed to be, as medications that are regulated by the FDA are. So some people were hospitalized for significant, issues for lengths of time. Other people were able to stay out of the hospital, but were treated for, days and weeks on end. So it was a really big deal. So,
then of course the media picks it up. The CDC actually put out a formal statement, which is always a big deal, and spoke about the dangers of it. And the reason we bring it up on this is because it's so important to understand the difference between illegal Botox and not Botox. But the problem is, for the general consumer, how are you supposed to know? And that's what we go back to every single time. And I've said on this podcast a million times about credentialing and making sure that you know how your provider is credentialed and asking.
Yeah. I mean,
and not being afraid to challenge that. And it is so not normal in medicine. You walk into a doctor's, if you make an appointment at a clinic, it's medical clinic, a GI clinic, and the guy walks in with a white coat, and I'm Dr. Smith. Nobody is ever checking that. What if he stuck in the back door and just decided I'm going to? I mean, sure, is that likely? No, but the point is, it's not traditional in medicine to question the person in the white coat or the person in the position of authority to what they're doing or saying.
Yeah, for sure. And then take it to a med spa where most clients don't consider those a medical practice, even though they are and they should. And you're super not asking, or you're just going for the cheapest possible place because it's cheap. Well, it's very unfortunate that this happened to anybody, but it's also like so happy that nobody was permanently injured to my knowledge. And I could be wrong about that, but thus far, I'm not happy that it happened. We want to keep highlighting it to show like there's a reason why. Let's start with the main thing. Botox from a legit source costs as much as it does because you are getting it from somebody who went to school for years and years and years. And also that product costs
$656 a bottle.
Yeah, for us to buy. Like that's only 100 units. And the average client gets about 64 units. So you can imagine it's extremely pricey for us to buy. So that's highlighting the reason why someone's going and getting it somewhere cheaper. But then you as a consumer or client, I mean, picking what goes into your body based on the cost, like, is appropriate in some instances, or there are boundaries, of course. If you have the same exact drug, and one's generic and one's not, obviously we see that all the time, trade names versus generic names and stuff. It is not appropriate in this space because there are, it's just not appropriate in this space, and it's appropriate in any space if the right questions are asked.
Well, I mean, it always makes me laugh. If you think about going to your primary care or something or anywhere and you don't have insurance and you walk in and you consult with that provider, and that might cost you, $200, $250 to consult with a GI specialist.
Oh, yeah.
And you get nothing. There's no medicine. There's nothing. You're just getting that person's experience, opinion, and professional from school and stuff. Okay, so great. So now you're going to come see me.
And my consultation should be free.
But the medicine, my consultation is free.
Certainly be free.
Absolutely. Why would I ever come and talk to you with your experience and your nurse practitioner?
What?
Like, I should pay you for your medical professional opinion after you've had all that training? But I don't question it all when I walk in and get a doctor's opinion on something.
And every appointment costs you something. Every single appointment is billed to insurance.
Yep.
Follow up.
Yep. And if you don't have insurance, it's hundreds of dollars. So then add on the fact that the actual medicine that you came to get from me is $656 a bottle. Then
my cost.
Plus you're getting me, the trained professional, to do it, and people are mad at it.
Plus the supplies to do it, plus the lights out of the building, plus the chair you're sitting in.
Why is that a gap, and how can we fill it? And that's what's sending people to Groupon and I can do Botox for $100 and all that. Where is that gap, and how can we fill it for people to understand?
Unfortunately, it's events like this, in my opinion, that are going to be the major thing that fills the gap. But we know from history that even medical events that are super negative or bad things happening to people, and even ending lives, still isn't enough to tip that won't happen to me or that one or whatever. So. But we can keep highlighting it and keep talking about it. So, to summarize that, it's just the same thing that you've heard us say on podcasts and Instagram. I post on it all the time, and it's always in my captions. Like, knowing your medical provider, knowing their credentials, knowing their training, and asking, having the goal, having the confidence,
the cojones,
to ask your provider, where did you get trained? How long have you been injecting? Right. And it's not to say that a new injector, someone that says, well, I was trained recently, but I've been a nurse for 15 years, or I've been a nurse for 5 years, but I was recently kind of trained on these techniques. And so that's great. I'm not sitting here suggesting you should not see that person at all. Are they a nurse, and how long have they been
your medical director?
Using a needle? Yeah. Who's your medical director?
Well, I don't need one.
Yes, you do. Yeah. Especially they say, well, I'm a registered nurse. Cool. Every single registered nurse in this entire country has to have a medical director in order to be doing a med spa, Botox, juvenile, microneedling for the most part, so many things. So, ask questions. And I mean, if you're listening to this and you hear this and you're like, well, I still don't really know what to ask, or I'm in, Montana and I don't know what to ask, send us a message. I'll tell you exactly. I can give you a very quick little 4 or 5 questions that you should run through with every medical provider you see, including your primary care and everybody. But this is a medical aesthetics podcast, so when you're going to get these treatments and services for people, and it's something especially that's being injected into your body, ask the questions. So all that being said, friendly reminder, Smiley Aesthetics gets their product from Allergan. We're one of their top accounts, or the top 50 account in the nation, actually, which we're very proud of. We spend the money to get the quality product from the right place, and so that we can keep our patients safe. And also we're compliant, which is directly related.
So what was the other clinical?
Oh, so another thing that's come out, and this it's hit the media, but I don't think it's spread quite well, is it's in California. So once again, we're not in California, but it's just reiterating the same exact points we just said about the botulism incidents. But 3 people have gotten HIV, people, like a life-altering, non-curable disease from vampire facials from a clinic in, I believe it's in California, but don't hold me to that, from the same place. So 3 separate clients got, now they say vampire facials.
People's blood? What are they doing?
I don't, so vampire facials utilize PRP, and typically you draw the patient's individual blood each time. So patient 1, 2, and 3 would have patient 1, 2, and 3's blood drawn. And then you would use their own blood and microneedle it into your face. I assume they're using needles again, or the tubes, the PRP tubes must be being reused, or they're mixing patient blood, which I don't know why you would do that, but it doesn't matter. In New Mexico.
Unlicensed spa in New Mexico.
So, once again, unlicensed spa.
According to the CDC.
Yeah, and this is a CDC report. So, I mean, that's as legit as it gets. So, it's just, you hear the same words over and over in regards to this stuff, unlicensed and, just unlicensed professionals. And, can we prevent it? Can a licensed professional, have someone do this stuff? Can they buy their product illegally? Can they, yeah, sure, we can. But it's interesting. You don't see it happen that often because we don't. And also, the oath that we take to protect our clients and our patients, we take very seriously. So, there are definitely, it's not to say there aren't some probably shady medical providers doing some shady stuff, but your statistics are, in fact, like just simply lower, and you're safer going to licensed medical providers, going to licensed medical spas, and asking those questions, and, versus Groupon and, that type of thing. And I'm going to go ahead and just trailblaze around into a topic that, that's a little off topic, but, so let's talk about, mobile aesthetics businesses. I just saw recently on Instagram where someone pretty influential had made a blanket statement about mobile Botox or Botox parties, and that being like something that is just not something we should be doing. And it's like, we completely disagree, because when you look at who is the facts of what's going on at, like, let's say a Botox party, in whether it's in someone's home or wherever, some argument is that, you can't. So what's the difference in having a Botox party in a med spa and in someone's living room? Well, let's start with who's doing it. Okay, so it's the same person doing it in the med spa's living room. So we covered that. A licensed medical provider who's been trained. Great. Where they get their product? Same. They've done that appropriately. So they have the correct products we're using, and they have the supplies, from the syringes to the alcohol swabs to whatever. So then what else is different? The environment is different. Okay. Well, the air in someone's living room is pretty much the same as in a medical spa.
So we don't have, and then that's actually a fact. There's filtration requirements
in hospitals and stuff, but in med spas, they're just commercial spaces and just
we don't have sterile.
Yeah, there aren't even actually pet things that are different in many med spas because they're not typically regulated by the Department of Health. So, A lot of people will have pets in their med spas. They're not in their treatment rooms.
Office dogs, like a dentist office.
Right. Much like in hospitals, service dogs that help patients, like they're clean. It's not about the pet. It's about how what the provider is doing. So, one big argument someone had made to me, well, you can't control the environment, just a hectic environment. It's like, yes, you can. Actually, when we have our Botox parties in people's houses, it's in a certain room that's separate from wherever the party's happening. We, of course, are mindful of alcohol consumption, as in none before you get your Botox. And, we control the environment as if you walked in the med spa and got it in that room, in the med spa room. And then so it's like, well, kids and animals, once again, we control the environment. And if the environment is not controlled, then it simply doesn't happen. So then someone's other argument was, well, the emergency supplies are not available. Yes, they are. We bring with us a little caboodle, the same exact products for dermal filler as well. The Hylenex is with us. The syringes, the Benadryl, the everything that we do in the med spa is recreated literally almost
it's
to a
different than wow. And then I just go back to so many easy questions. So would you ever allow home health?
Yeah, our home health thing's done. Our hospital rooms built in houses for
literally
certain clients.
Rented patients at home.
Yeah,
like come on, people.
That's a good point. I didn't really think.
We rolled my eyes so hard.
It's all about the provider washing their hands, being clean. These are not sterile procedures done in the OR. We do consider dermal fillers, implants going into the body. Yes, absolutely. Therefore, I need to be doing it. Do you do it sterilely in the med spa? No, you do not. So we keep it as clean as possible, as close to sterile as possible. It doesn't matter what room I'm injecting it. It just doesn't. My process is the same.
Right.
And,
certainly for Botox.
To date, we've had zero infections.
Another easy one for Botox.
Insulin needles used at home. Semaglutide.
How many people give themselves semaglutide or insulin shots at home?
That's a good one.
It's the same thing.
Are you allowing your clients to inject? Because I guarantee you this person I was already semaglutide at home, you are? Gosh, that's a deeper injection in most cases than...
That seems a little scary.
Semaglutide, yeah. So that's a really great point.
It's just so silly.
I need to go back and bring that point up. So... It's not silly. It's a good thing.
Silly.
It's a good point
because it's ignorant.
It's not. These are not ignorant people.
That's
making
the problem.
Comments. It's just.
I'm not saying they're ignorant people. It's ignorant comments.
They're just trying to take a stance because they probably don't have a mobile Botox
or mobile.
They don't have a provider that they're making the money mobile. Yeah, and so they're just trying to, But anyways, when you really look at hard and fast, okay, so we can use statistics in Smiley Aesthetics. Like we have 5-6 brick and mortar locations. We're opening 2 more. Like we've treated thousands of clients in our brick and mortars, and we've treated thousands of clients mobilely. 0 infections on either side. Boop, go team.
Go team.
0 actually truly adverse events. We have had a couple of VOs in like different situations, all resolved, all handled exactly. In fact, one of those was in the mobile setting. And then that was resolved beautifully, if arguably better than any other time. We've had like one in training that I know. It just, it doesn't matter. It's about the training. It's about being prepared. Mm-hmm. It's about, of course, having the proper supplies on hand. Yeah,
whether that's where you get your product or whatever the case is.
But I mean, where we provide medical treatment, is it ideal to sit in a med spa chair in a med spa with a glow light? And, I don't even want to say yes to that because quite frankly, I just don't necessarily agree with that because it comes back to the provider, the gloves that are used, the hands that are washed, the environment that is set. So we allow children in our med spa, which we're happy about. If that child is bouncing off,
treated,
If that child is bouncing off the walls and causing chaos and the parent cannot calm them down, guess what I'm going to do? Stop my treatment in the med spa. Yeah, just like I would at home.
Yeah.
So I think point made. So my little tangent. Okay. The non-clinical thing that we are obviously, the Federal Trade Commission passed a law through just them currently that says that non-competes are not enforceable. There's some caveats. You don't need to go into the details about it.
Yeah, senior executives and a variety
of things. So the final rule is what they're calling it.
Goes into effect
120 days from April 24th, maybe. It is currently being opposed and attempted to be blocked by several major groups. So
we stand. I'm in the middle on non-competes. I think that they are abused, but I also think that it is a very bad thing. I think that people that stand on either side strongly, again, are it's so difficult to read. People that say someone should absolutely be able to take their skills anywhere. There should never be a non-compete. You're just not thinking.
Yeah.
And you're not thinking because because you're in your tunnel. You're not thinking of a business or company who has a proprietary information or knowledge and creates this water bottle, and it is unique, and you and
you're privy to that information.
You're privy to that information, and you see the manufacturing, and you have access to everything, and then you're like, cool, and you literally go replicate it.
Yeah.
That is why a non-compete is in the world.
Let's just keep going with some examples. So medical aesthetics, let's go there. So clients, service-based things, and to an extent, there's a level. Hospitals and stuff, we can talk about that, but service-based things like salons, hair salons, even nail salons, and things where people are loyal to their clients, especially medical aesthetics, where client loyalty is like a lot. Injector loyalty is, it is high.
Yeah.
So an injector.
Same reason you go back to primary care.
Yeah, an injector comes into your med spa, learns all your, in a new injector, let's say that, and they stay there for 6 months, and they see what supplies they like best. They see the processes for how you work your med spa, how to work, just all the ins and outs of being in a med spa, and they gain 6 months worth of clients off of your med spa's marketing. So I'm not saying they didn't get some of their own whatever, but your med spa, they're using
some
med spa.
Some was word of mouth, surely.
Well, they're using, or usually about the med spa and how great the med spa is. So they're using your med spa to garner these clients, and then they can just literally set everything up, and then next day walk into another med spa or their own med whatever, and take every one of those clients with you. And so people will then argue, well, non-solicitation, you can't solicit your clients. If you can QC that and make sure that, what she's posting. So what does that mean? That person can't post on Facebook announcing their new employment opportunity.
They have to ban or block every client that's on their friend list. That was a client.
No.
Yeah.
In my opinion, just like everything else in life, quite frankly, I stand in the middle as well as there's hardly any topic I don't swing one way, totally one way or the other. With exceptions, of course. Let's not anybody troll that. But, this is one of those things where, do I think that as an anesthesia provider, where customers, patients don't even remember me. Like, I put them to sleep, they've got amnesia,
Exactly.
like they do not remember their anesthesia provider. Most of my non-competes are 2 years within 50 miles of the hospital I was working at.
Yeah, why? How in the world does an CRNA have a non-compete?
Yeah, what am I gonna say? What am I gonna post? Hey y'all, if I put you to sleep, I'm leaving and going.
It's not even that. So it's not about you and the client base. It's about it's about you not being able to go and garner a better wage or whatever, or get a better deal. Like if CRNAs have non-competes, why don't nurses?
Yeah. No, it's crazy.
It's doesn't make any sense.
And so it's like if I'm the FTC, in my opinion, you had to dive into different specialties, different industries, and then different sub-industries in there to really understand why, like, a non-compete for it does not work for a CRNA at all, but for an aesthetic injector, it absolutely does.
Or a massage therapist.
Yeah, right. Or a hair salon.
Hey, I brought you in. I
nurtured you. I trained you.
And then people's answers is like, well, put in clauses and stuff about what? Like, you have to pay us back. If you don't stay for 2 years, then you owe me back money. Yeah. Has anybody ever tried to go get that money?
Yeah.
Yeah. It's real hard.
Yeah, you got to sue them.
It's real hard. I mean, you got to sue them. Like, it's just not really overly reasonable for the general public to do. So I bring you in. I trained you. You shot all these things. I paid you. While I did all of those things,
it's crazy.
And I had this established spa, I do marketing, I've built this great following, this great client base, and sure, I have 10% of my clients love you.
Oh, the other argument, I love it. So employers are like, well, if you'll just treat your employees well.
They won't leave.
They won't leave. And it's like, I can't even. You could offer, somebody the moon, and if somebody offers $5 more an hour, you better bet Susie B is probably going to take the $5 more an hour.
Or you have the people of the world who do truly have an entrepreneurial spirit, or they think they do, and they're like,
I can do this myself.
I can do this. Well, sure. Once you come in and learn everything there is to know about running said med spa, you absolutely probably can when I give you a friggin' leg up 90% of the way.
So once again, while I truly don't think this is actually going to ever go into, so everyone calm down. Based on my minimal research and speaking to our legal team,
you should be concerned.
Yeah, I do not think this is actually going to go through and, whatever. So, and also even if it did, there are still, things, at least in our contracts, that like prevent you from just running away. So yes, everyone just needs to calm down. If you're a medical school,
but I do agree that you want
hold
to
on.
make them stay.
Yeah, well, and I want to relate it back to why we're kind of passionate about this topic for Smiley Aesthetics. So, part of Smiley Aesthetics outside of the traditional brick and mortars is fostering entrepreneurs and opening their own business. We give, and I'm going to get on a little high horse here. In light of just some recent things,
true.
We give
on the front end
hundreds of thousands of dollars worth of information in the medical aesthetics, especially. We give. I say give. We hand it over for free. We give it to them initially
after a contract.
After they sign a contract, we give them years of information from a legal, business, and clinical standpoint. We just hand it over. And I don't, we have protocols. We don't just hand it over. Like we protect it the best way we can.
Yeah.
But we're also,
we're still policies and procedures.
It's things that, that cost so much money and it has cost us millions of dollars to build.
And to your point, experience, time, the career, the education, all the things that go into that.
25 employees we have that we pay.
Yeah.
To provide whatever. So all that being said, so we do this, and then, we have, currently as it stands, we have a non-compete and a non-solicitation. We have some other things in our contracts, once again, that most people don't read contracts, so they're totally unaware of. Everyone panicking is like, but if you had a good attorney, which we do, your contract's going to be okay, most likely. The point is,
6 months in, they're like, oh, I can do this
myself.
Well, I could be making more money if I was doing this by myself, which is also a hilarious.
Yeah, we don't take any upfront fees. It's a pay-as-you-go. It's totally based on products and services provided. Like, we provide the medical director, the EMR. We pay for so much stuff. For
the value that's also provided of being able to ask a question and get an answer on any legal, clinical, business, or operational answer that you need. This doesn't work where you fix it. Done. The values and things of that.
They don't understand that. And don't see it. And then it's a lack of realizing what they're learning indirectly. So when they may not have a problem, that Susie Q brought up, but they know the answer to it because they saw the question asked and the answer provided.
They've seen
in the community that we provide 24/7. Chat, email, just 24/7 support.
You're getting constant education because Susie posts in about certain lips or a certain way of a certain set of cheeks. You may not. You just got to watch Mary answer that question, which is no different than watching her train her on how to do those lips.
Because we're a very non-competitive company, so our community, people, just post anything, Anyway, so the value. I don't have time to speak to the value of Smiley Aesthetics, which maybe we should do an episode just solely discussing the value, what we provide as a company.
The point is, if that rule goes through fully and people are allowed to just walk away.
Well, once again, if your contract sucks, which ours don't, but if your contract wasn't done well, it doesn't have certain clauses in it, then hopefully you all are seeing what we're highlighting. You can take everything that we provide, you could copy it, and then, take it and try to do it on your own, and we can pretty much guarantee
I do think that's the part of the people.
They don't understand.
Oh, I can do this for myself, and you do, to your Mary's point, indirectly don't.
Which is so funny when I say we have 25 people behind the scenes working for each of these independent med spas, and I can just go do it
myself. And it's like, okay,
cool. I mean, we don't.
That's our goal, is for you to get to a point where you're set up well enough that you can get to a point where you're operating a med spa independently, but not like we're still always like basically in the background because there's still so many things we're doing to continue to make sure you're supported. But again, to your point and related to the FTC and this non-compete, so much of that value is in that setup.
In the initial part.
And
that's not something we can't just
free.
We can't just like drip that out. You can't drip it out.
No.
We've really wanted to say we don't want to we don't want to take money up front from these entrepreneurs because as people who have started businesses know, you're cash strapped basically 100%.
And as a medical provider,
that goes against our mission.
No one wants to spend more than $12 to start a business.
So just kind of relating back for those that have a hard stance on, that there are businesses like ours out there that, do things like this, and it's our model, and ultimately of 99.5 out of 10 providers that it's great for, and we don't have a lot of tuition, but then we have just those people that would take what we've given them and then try to go do it on their own, and you can see why that is like detrimental to our company. So we can't be very much for that type of non-compete.
And it is absolutely that would break down our model if that were the case. I think that there would be so few who would actually try to do that. To me, it's more about the arrogance that people think that they can just go do that. Or the lack of awareness, or the lack of thought or self-awareness of how much that's been given and how much they get.
Many of the people that come to us were already trying to get into the medical aesthetic space and were unable to do so. They could not find answers to questions. They could not. It's like we are not a service where, let me get everything I can from them and then just leave.
Yeah,
it's just, there's some moral and ethical considerations there. And then B, we offer buyout. We offer a buyout at a client. It's like, okay, we are sure, go do it by yourself, of course.
Yeah.
But like, we're not like a, and this
doesn't mean the last 6 months is free.
Doesn't mean it's not business. Yeah. Like
sure,
so all that to say, it's just some different ways to think of, the non-compete. That's kind of our stance on it. I think there's totally areas that it does not apply. I think there's areas that it absolutely should be considered. I don't, for the record, think that is actually going to go through. I don't think there's any world that the government's going to be able to govern states and how they run their own businesses and stuff in this way, and just make a blanket statement like that. So we'll see what comes down. It's all about being
why.
Huh?
I'm just curious as to like what conversations happen when that.
Because, I've read some of it, and it's just the thought that this will open up, bring in billions of dollars into the country, basically any industry, because employees that have been stuck somewhere will finally be, I don't know. There's like, I don't know. I think there's like reasons. That's all fine and good. It's just like, you're talking about closing the doors for some people. A lot of people. Like, you'll close as many doors as you'll open.
But also, just because those employees have been somewhere and have been stuck and can't go do something on their own, doesn't mean they're going to have the ability to do that.
Well, then in
some ways, it's like how many of those, 6 out of 10, 7 out of 10 businesses fail. So
you're thinking of it from an entrepreneur that most people will leave and go do their own thing and start their own business. And we might see an influx of people doing that and some little uptick of something, and then it might be a horrible crash.
Yeah.
Once again, I don't
think all these people left.
Don't think it's going to go through.
Yeah.
So, okay. All that being said, that was kind of just what we wanted to run through today. So just a random, kind of random assortment of things. Keeping this a little short today. We go on vacation the back half of next week, but we are planning to put out a podcast. To hear. Yeah, if you, per usual, we have our Patreon. It's patreon.com/Smiley Aesthetics. We've really put some effort into that in the last few weeks, and we're going to continue to do that. We've poured into that and put somebody on that more formally. So go check that out, and for really good, more in-depth medical spa, medical aesthetic stuff, business, legal, and clinical. And then if you're wherever you're listening to this, you can hear on Apple, Spotify, iTunes, and then YouTube if you're watching it. And just give us a like or a share, because it really helps. It really helps us. Yeah. What else? Okay, so we will see you all hopefully next week.
Yep.
And thanks so much.
Thanks.